Welcome back, viewers. I'm going to call this briefly onychomatrixoma, but then again, not really, because if you Google that term, you'll come up with a range of scientific articles, and they'll talk about this being a benign, fairly uncommon fibroepithelial tumour of the nail matrix. And truth be told, I don't think I've ever seen one, at least not one I've seen on histopathology. But what I do see from time to time is after an incisional technique, so classically a Zadig procedure, that there's a little bit of a root ball of matrix and germinal nail tissue that's left sub skin. And here's a case that presented to me a few weeks ago. You can see there's a little bit of a growth proximal to the nail. This lady had had total nail avulsion with phenolization performed expertly by a podiatrist, but it would look to see a little zoom in on the proximal nail fold. There's a small lesion there. It's firm, it's white. When I first saw that, it almost looks like a gouty tophus. So order of business was to get an X-ray just to see whether it was radiopaque, see whether it was any kind of bony fleck, because it was firm enough to feel like it could have been bone. So organise an X-ray, and you'll be able to see on the lateral view coming up. There it is. There's the lateral view. You can see you've got that discrete lesion dorsal to the proximal phalanx. So this looks like one of those aberrant, recurrent bits of nail tissue. Either way, surgical excision is the way forward. So short video, not that short, coming up. Right, okay. Now we'll do it under a little tourniquet. So
the England match.
Fiona, sorry, I meant to say, can I have a 15 blade chuck you? 1-5. No.
15-inch blade.
15, no. Don't mind.
On a handle.
Don't, yeah. Doesn't matter. On an handle, are they in there?
How big's the blade?
You will have to have a handle out from one offset.
It's fine.
Ooh. That's cooking himself a bit more.
Okay, so now that's a little tourniquet. That's fine, man. That can stay there. Alright, so that's that there. Love it. Probably a better fit, actually. So Mary, just testing again. No sharpness there, Chucky egg. Super. So we've X-rayed this, and we could see there's that little shadow on the X-ray, but we know it's not bony, because I think somebody else had suggested it might have been a bit of bone, didn't it?
Yeah.
So we don't not think it's that. Fiona, have we got a suture as well? Because I might need to just put a little stitch
Oh, no,
in it. I am, aren't I? We had a patient in last week, actually, Mary,
Right.
and she was an ex-nurse, and we got to this point, and she wanted to put her own stitches in.
Really?
Yeah, well, I said, suit yourself. I'll do that joke again. Thank you, Sir, for laughing at that. Suit yourself.
Sorry?
Perfect. Suit yourself. Never mind. If I have to explain it, I'm working. It's too hard if I'm having to do it. If I have to explain a joke. Explaining a joke is like dissecting a frog. Nobody laughs and it doesn't actually work afterwards.
So I'm not listening, I'm just speaking. I'm going in the world on my own.
Do you want the couch up?
No, because the camera's just right.
Because you know that's how you do your backing.
So I've heard. Ironically, I get people's backs up from time to time, but that's different, isn't it? Okay. Well, that's a bit hard in there. Ooh. That's a technical term.
It's surely not bone though, is it?
No, we've X-rayed. It's nail.
Like the root of the nail.
Like the root of all evils.
Oh.
They say, don't they? They say, money is the root of all evil. Do you know that's a misquote? The actual quote is the love of money is the root of all evil. Men, we're not evil. We just have a problem. We just have a problem. And
No, you're very nice, really.
well, I'm not, but I know most are. Mary, have you ever had gout?
No, not at all.
Hmm.
That cause of that, is it?
Gout.
Gout.
What's that got to do with a nail?
When it comes out, this looks like it's nail, but it's also got a little bit of a gouty look about it. We're going to send that off to Histo, sister, if we can, just because they'll tell us what it really is.
God, I've got.
You're so.
Stickers for this,
You'd like to say so, but no.
You haven't?
Not in the traditional sense of the term, no.
Well, that's not good enough, is it?
No. It's not the first time I've let you down today, is it?
No.
No, it looks more naily, but we send it away, Mary, so we can see what it is. Because guess what? We ain't got microscopic eyes.
No.
So that's down to soft tissue there. So it's kind of cool, is that? I'm liking that. And while I'm being Mr.
I've
Demanding,
written that on, but I will do stickers.
Yeah,
so
smash.
can you put it in there?
no, I'm going to take a picture of it first because I want to have a picture for the video. We don't have any curettes, do we, by any chance, while you're there? Just to give it a bit of a scoop. Because I'll use this black file, which is nearly as good.
Now,
Now,
you can have, in one of the iCys things, there's like a mini curette.
you're loving it.
Would that be big enough?
That would be lovely.
Right, you need to let me buy it. I'll be back.
I'll be back.
And there's a little sack in there as well.
Sack.
Really, look at all this coming out, Mary. This is so cool. I knew it'd be kind of cool. Are we still in shot? I'd be devastated. Oh, look, we're missing Mary. You had one job.
Oh no, I'm looking up at the ceiling. I'm not looking.
No, you're
You alright? It's impressive.
It's impressive. Everybody's going to be coming in. Oh.
Told the GP yesterday he had to be bare below the elbows. He's got his sleeves rolled up today.
Well,
I am that scary.
you are a little bit, but you know it's not difficult. We've been doing bare over elbows for
He
bloody
said,
years
is that
now.
really a thing? I was like, it is.
Of course, it's a bloody thing.
Is that big enough?
Perfect. That just nice to sort of give it a good clear out. So there is a little sack in there, really. A bit of, so I think if we can kind of get it all out, Mary, I think it will not come back.
My goodness.
Mm.
I'm talking about you opening a packet or me.
No, my packet opening skills. Does help if you open it the right end, doesn't it?
Yeah,
But today is not the day.
and we know why.
So it's like a cure at both ends.
You say about curing.
Used for said eyeballs.
So Mary, do you know what happens if you eat too much red meat?
What's that?
You die.
Yeah.
You know what happens if you smoke too much?
You die.
But what happens if you smoke red meat? You cure it.
Oh my God.
Oh dear. I'll give you a joke.
What time are you till today?
Only till 5. You haven't got a full day today, sister, don't worry.
I'm working late till 5.
Well, start at 8. So, Mary, I think that was all nail. We'll send away that sample. There's a little sack in there,
Right.
which we've taken out. This is me just curetting the rest of the sack. So, but it's really odd. I mean, it could also be a bit gouty. That's why we're going to send it away to Histo, just so that the Histo guys will say, yeah, but it looks more naily than gouty.
Right.
So I'm just trying to get anything that might still be rooty. Do you know what I mean? Like a root sort of growing it back.
Yeah.
So,
Quite the right size, really, considering they use that on eyelids.
yeah, it's just the right size. Is it ectropions? What do they call them in the life things?
Glazings. You
So-
know, like the cyst on your eyeball.
Yeah.
They turn
Oh,
your
yeah,
eyelid,
yeah.
They
Yeah.
turn your eyelid inside out, stab it with a knife, and
Right.
give it a going over with one of them.
So I did talk myself into suturing. Monocle. Cool.
That's how they do it.
That took you.
Monochrome.
Absolutely.
It's a long walk if you don't want that.
Yes. Monocle will do just fine.
What's that?
So just because they're a little old, we'll just put a little stitch or two in
It's
each.
dissolvable, these stitches.
Oh, hello. Right.
So that looks to be nail root. So what I can't say is, although it's all out now, whether it will grow back. It shouldn't.
Would that skin go down now? Or what?
Yeah. It'll basically shrink back down. So that should, he says should. Sound like fog or leghorn. So it should do it, Mary. But we're going to follow you up over a wee while just to kind of check.
Right.
But that's a doozy. There's lots of stuff coming out of there.
Oh, right.
But you know, you get. I've seen a few where you get like a little nail root ball. The technical word would be onychomatrixoma. How cool is that?
That's a bit.
Yeah, I know it's a bit me showing off with the camera now. And because they grow, but they're not going out of the skin. They've got kind of nowhere to go. A bit like my career, really. So they just carry on growing and growing and growing. And I think eventually they do kind of pop out.
Oh, right.
And then we'll dress that up, and then I've got the other toe to do, haven't I? I've got a nail on to the side to do.
Oh, if you'd like to do it, that would be good.
Do you know, she put it on the consent, so I feel we should.
Yeah, might as well.
You know, you're here, aren't you?
Mm.
Questions, Chucky Egg. Do you have any questions for me?
Will I be able to go back to work?
Yes, but I want you off light duties for a couple of days. Did a crap job there. A couple of days taking it easy, all right?
Okay.
What do you do?
On lunchtime, so I'm only going for an hour, lunchtime supervisor, so I'm on my feet for about an hour.
Yeah, I guess that's during lunchtime, isn't it, really?
Yeah.
You're at school?
Yeah, it is, yeah.
Children.
It's one thing you can get your next career as a comedian, can't
Do you know what? I'd like to do that,
Yeah.
really. I think that...
Like,
See you on stage.
that chaser.
Chaser. Whiskey chaser?
No, you know the
The quiz
chaser.
show. Yeah, the chase.
The chase,
Yes.
that's it. Is it the Cinnamon? He used to be a doctor, went to be a stand-up comedian,
Yeah.
ended up on the chase.
Well,
Oh.
I tell you what, when I was young, I told everybody I wanted to be a comedian, and they all laughed at me. You know what? They're not laughing now.
Yeah, why not?
That's a Bob Monkhouse, isn't that? Bob Monkhouse, he
But
was
you
funny.
know, it's possible, isn't it? Anything's possible.
It is. I don't think I'm going to make any money with my jokes.
No.
But, you never
You'd
I
know.
be
was just going to
surprised.
see you because I knew you and go,
Ha
I've
ha.
done it all before.
Yeah, I think some new gags, wouldn't I?
Oh, that's a big fun.
Well, just because it can be a bit cheeky sore. Right. Avez-vous un sticky sore sister? The greenish pink. Oh, wrong.
It's sweet. I can't shower that one.
Well, you just case keeping it dry.
Not really.
So we'll get you back in next week, Mary, and
Right.
we'll check that. There you be.
Okay.
Here she comes.
Cushy.
What can we do you?
Borrow this cup because that other one's just water on me.
Awesome.
Oh.
And here are the bits in all their glory. You can see there's actually quite an amount of tissue. It's probably about the size of a big baked bean. Kind of came out. It wasn't like a whole nail unit where it was compact. It really was friable and just came out in bits, as you saw from the video. So while I've probably referred those to them as an onychomatrixoma, I'm really kind of giving it the wrong term there. Every day's a school day, viewers. So I really, what would we call it then? I don't know if there is such a name for a recurrent root ball of matrix. It kind of needs a name. Maybe we could call it Riley's regrowth. No, I can't name it after myself. But anyway, done the odd few of those. I've tried to get really all the sac out. There is an argument, and I certainly considered putting some feel in it, but obviously would have needed to have left the wound open, very close to the joint, and I shall follow up to see that we don't get any further regrowth. So that was very much a thought running through my mind is, have I got all the tissue out or will it come back again? And we will apply the tincture of time to that, i.e. we will see. Thanks for watching as always.